ক্লাস 12 কবে? Namaskar. Very good afternoon. A very good afternoon. This is Shwetali Sengupta from Aspiring Life. So, again, I'm here with a topic. Okay, it's a very important topic. Since I'm not a doctor, and what I can do to aware the parents and other students who want to aspire to be doctor is to bring one of my student here with me live to give you more details about that subject. The subject is community medicine. It's a branch of MBBS. I mean, medicine. It's a branch of medicine, and it is very important. So, can I have Akash Datta of BGC third year with me in the show?
Namaskar, ma'am.
Namaskar, namaskar.
Namaskar.
Akash is soon going to be the doctor. তো এখন থেকে নমস্কার করা প্র্যাকটিস করছি আকাশ। Anyway, Akash, how are you?
Ma'am, I'm fine. And you, ma'am?
Okay, good. So Akash, today after always in the college you have Viva items, everything. Today I'm going to have a small Viva session with you. And the topic is
Yeah.
very interesting, as you already shared with me. To the audience, that day I was simply scrolling my Facebook and I saw Akash wearing a mask with the apron, writing something, and I paused because the Akash whom I met 3.5, 4 years back was a very different boy, and now there is a touch of looking like a doctor. I immediately called him and I asked him, Ki, Akash, where are you? I mean, what are you doing? How is your health? He said, Ki, ma'am, it's a tour for community medicine tour. And I understood. And then I start scrolling. Then our other students are there also with lots of picture they had posted with small children, their parents, old people. Then I thought ki we should all have a session on community medicine to tell the mass how important it is. Tomal, can I please have the second page of the gadget, that extraordinary gadget? The second page, please. Can you show everybody the gadget, the second page? Can you just zoom it on the syllabus part, Tamal? Can we just zoom it? Yeah. Here, it is mentioned about the, all the subjects, out of which community medicine is very important part. Okay, thank you, Tamal. So it's a very important part, this community medicine subject, and in many countries it is not taught because in many other countries other than Bangladesh, the students are restrained from touching the patients or see them. So here we can see in this clause 2(1)(a) and that B. Student, and it is saying in the same foreign institution where the primary medical qualification has been obtained along with hands-on training in clinical subjects, including but not uh, limited to community medicine, general medicine. So community medicine is very important here, psychiatry along with, so these subjects a student need to learn and have good practical hands on it. Thank you, Taman. Thank
Yes.
you. Yeah. So Akash, it was indeed great to see your transformation when you first came here, to look for a good college from us in Aspiring Life along with your father, your mother, and your maternal uncle. And today, when I see you, it's amazing. Uh,
Thank
I
you, ma'am.
want to know, even everybody wants to know, you give us detail about what is community medicine actually.
Community medicine is a branch of medical science. Everyone knows that. What it mainly does that it is helps in the prevention of disease. it prevention of disease, and it is a main thing. It helps for research purpose, research of disease, then finding statistics, disease like what is hypertension, there is diabetes mellitus, there is a tuberculosis, everything is there in a population. They find out the numbers, how many peoples and what are the age groups, and they make a statistics that how many peoples are affected in which age group, in which year, what are the peoples are getting affected in which in what population, what ages, so the treatment and the diagnosis can be made. Community medicine helps in, community medicine also helps in the immunization program. Right now there is a COVID-19 pandemic is going on, so community medicine doctors, epidemiologists, all are doing research works, the vaccination programming, how will it operate, in which group first they will be vaccinated, then naming all the all of the variants of the COVID-19, which group of peoples, what are the ages of people, in which area, in which country it is maximum affected. Community medicine help in this way. It is a mainly a field work and a survey, and in clinical medicine it is only a clinical related work. But depends on, but community medicine is the important thing is the field survey.
Okay, that's lovely. I mean, when you were saying, I was so amazed. I was really thinking that, I'm talking to a doctor who is so experienced and
No,
all
ma'am.
that. Good going, Akash. Good going. So proud of
Thank you.
you. Uh, but Akash, can you, during this community medicines, uh, can you give injections to patients, or it's just a field work to do a proper survey, or can you put saline? Can you, do any kind of treatment, or you can simply check the patients, variety of patients with variety of diseases, and just make a list of it, just as you say, it's a field tour or a field study.
Yes, ma'am. First of all, there is a field study. If we found in a field where there is maximum immunization is required, then there is a deficiency, there is some disease in the infants are going. So the camp will be there. There will be a field study, door-to-door study. People will go there, make a camp. They will check the patients, the infants, their weight and everything. They will give a chart, just like a doctor diagnosis. What will be then they will give immunization, vaccines. Yes, but the foremost thing is that community medicine, they will do the research work, the surveys. Then there is the secondary thing is the treatment that comes.
Okay, that's lovely. That's lovely. So, how was your experience? Where did you went? I mean, which place you went? Because you were studying in
uh,
Vizisit under Chittagong Medical University. You were placed. Your
yes,
college is
ma'am.
in Bangladesh, in Bangladesh. So, where you went? I mean, how far it was from your college?
In our third year curriculum, there is a residential field site training which also common in India. In the residential field site training program, the college took us to a there is a village called Dohajari. In Dohajari, we college prepared a questionnaire. In the questionnaires there is first of all we have to put the name of the person whom we are going to ask the question, then age, sex, gender, what is their occupation, they have any disease, they have any disease in their homes, if they are taking the treatment or not, then they are following up or they are not taking the treatment due to not able to bear up the charges of the treatment, and where they are taking in the Upazila Health Complex, in the nearest centers from whom they are taking their treatment in the to the other allied medicine doctors or not. So we have to ask this question. It is just like a survey report. So there is a day within we went there. Whole our batchmates were divided into small groups. We have taken the reports from there. Then that day we prepared our questionnaires. From there will be a statistical report will be there, which disease is more prevalent and more common. Just like hypertension, diabetes mellitus, I have found maximum in the female in the more than 50 years of age. So we have to create this biostatistics, which is important, which will be which will be required in our professional exam. Also, we have to tell in the professional exam viva, and also there will be an assignment will be created that will be created on this non-communicable disease. So on the second part, we went to Dohazari. Dohazari. Then on the second day we went to Bandarbon. Bandarbon is a hilly area in Bangladesh, which is near to Mizoram and Manipur. So we went there in the Upazila Health Complex. There we met the medical officer. the chief medical officer of that hospital. He told us about everything, what we have done there, what is then what will be our objectives to see their hospital, the everything. We have went to the pediatrics ward, went to gynae ward, gynecological ward, to the operation theaters, then their mortuaries, then their laboratories, then the drug where the immune, then the vaccine centers where all the vaccines are kept. Even we have seen the COVID vaccine where they are kept, how they are keeping, in which in which freezers they are keeping the vaccines. Then in the pediatric wards, we have taken our case histories of the babies. Then we have seen many rural peoples from the distant part of the Bandarban. They are coming, having dengue fevers. There is a prevalent malaria, dengue. Then infants having diarrhea. There are so many diarrhea cases we have seen that. Then fevers, then burn patients, then excessive chronic obstructive pulmonary disorder. They have a problem, lung problems and breathing troubles. So we have seen many things. And after 2 days, we have went to Coxbazar and Teknaf. It was our study tour. And in study tour, we went to the Teknaf hospital, which is near to the Myanmar. In the Teknaf hospital, there under the Teknaf hospital, there are many camps of Rohingya camps, those who came from the Myanmar. So we went there. We visited every point where World Health Organization, WHO, and the World Bank all are working together along with the Bangladesh government. They are donating money for the treatment of the Rohingyas, so that they can get a good treatment here. And also the handicap American institution, they also giving money. We have seen everything, and it was very helpful because we able to know how the field level, how the doctors work in the limited resources they are getting. We also able to know that the problems arising there, how to face those problems in the upojila level, how the doctors are performing and also the variety of disease which are getting in this remote areas. You're also able to see. RFST is a very important program. If whoever is coming in third year, they will face, and it is a great joy.
Lovely. That's really lovely. I mean, I can hear from you for us. So nicely you're explaining to me and definitely to the audience, and the audience will be helpful. Akash, it is very important branch of medicines, community medicines, which will help you
Yes,
as a
ma'am.
doctor. But when you go to these suburbs areas, in this, rural areas,
Yes.
do you find there are more cases, variety of cases are more?
Yes, ma'am. In
And what is the
Yes,
most
ma'am.
visible disease you see in children there?
In the infants, I have seen there is infections, there is diarrheas, and in the age group of 40, 50, in the males, there is COPD, then cancer, then colon cancer, skin cancers. Then in the aged female person, I have seen there is diabetes mellitus, chronic diabetes mellitus. They are not treating, they are not following up, and also the hypertension. I have seen high blood pressure. Then ma'am, all these are due to their lifestyles are not good. That's why. And also not following up the doctors what they are saying, the medicines they are not taking. So due to this, they are not getting the disease are not getting okay. And that's why ma'am, there's a huge problem these rural areas, in the suburbs. And they are opting for another kind of treatments, like those treatments which are not giving a good results to them. So it's a huge problem in the suburbs, and also in the rural areas. I have seen also there is problems, many problems in the not availability of good treatment in those rural areas. Just like if a patient has have got some strokes or any myocardial infarction, then where they will get treatment. And there are many patients we have faced.
Okay, okay. I understand that. Yes, in many rural or very suburb areas of India also, they're neglected. And this
Yes,
neglect
sir.
is due to these patients are not aware. There are
Yes,
still
not aware
patients
of this.
not aware, because even in us, even educated people living in the town, if there is something happen, we always say ki gas hua hai, indigestion hua hai, and we take those medicines. We really don't care
Yes,
whether
ma'am.
it's heart disease or it's anything else, so I think awareness is very important. So how many days you were there in those suburbs areas? How many days tour it was, this
Um,
community medicine tour?
Ma'am, Bandarbon is for 1 day, and the Coxbazar and Teknaf is of 4 days. Total 5 days, and RFST 1 day. And we went to Chittagong Medical College for this RFST program. It is of 1 day. Because of the COVID, it is of totally a 2 weeks thing, ma'am. If it is a pre-COVID time, the RFST is to go for 1 month long. And in Mirashwarai Health Complex, there was a program. All the students used to stay there, used to visit the Mirashwarai Health Complex. But due to the COVID pandemic, didn't happen, ma'am.
So, Akash, how is your journey? Because Bangladesh, to be very honest, was never your first choice, okay?
Yeah,
But
ma'am.
somehow we at Aspiring Life try to make you understand 3 4 years back why it is important, and I think now you're understanding. And you must have gone through the gadget where community medicines on the syllabus they mention in the gadget only goes very well parallel with MBBS in Bangladesh other than other countries, because in other countries you are not supposed to touch the patients. So are you happy now for the choice you made to
Yeah,
go to?
I am happy. Yes, ma'am.
I'm
I am.
happy that to see your smile, and when you're explaining things, I'm feeling so proud. And I think the aspiring doctors and the batch who will go there must be watching you, because you will be one of their senior. And I think many parents might get in touch with Akash. You all can get in touch with him also when he's free. He's always busy with his items, Viva, and everything. So, community medicine and public health is equal, Akash, or they're different?
Ma'am, same. They are not developed different. Community medicine and public health are same. Differences of community medicine and the clinical medicine are different. Public health is community medicine is for the health, for the treatment, for the publics, for the population, and clinical medicine also for population. But the difference is that the community medicine doctors, what they do, they find the statistics, they find the statistics of the disease, what is happening there, those disease, for they prepare the treatment plan. And the clinical doctors, what they do, based on the clinical trials, they treat the patient in their clinics. This is the difference, ma'am. And in community medicine, doctors prepare the camps, and they give immunizations, the vaccines, they prepare the treatment plans, they study how the disease is prevalent here, what are the disease here is. So it is different. There is slight difference between clinical doctors and the community medicine doctors. But right now in this pandemic condition, community medicine is getting a lot of it is a whole new zone which is creating. It is of great importance right now, and it will gain
Akash,
momentum in the recent coming
Akash,
years.
Akash, there is a question from you, some Mr. Anitur Rahman, who said, "Is education quality same as India?"
Education quality is same as India, same. And even we go to ward class. I talk to my friends who are studying in the West Bengal. They have also same ward class. Then ward finals. We also have same ward finals, same disease. So everything is same. Even they have the RFST program. We also have the RFST. They go for the autopsy. We also go for the autopsy in this period of time. Everything is same. Nothing is different. Only the same is that the Indian curriculum is short. Bangladesh is of 5 years, and total 6 years. It is of difference. Nothing else.
But it
The
is now
disease pattern,
becoming
everything is same.
same, more or less. Things are getting same. Even Indian doctors from private college need to sit for this, next exam.
Yeah,
So
yes.
slowly things
Everything
are
is going
getting
same.
very parallel and same. When it's high time, we can say it's same. Because there was a time when people used to think going abroad is like a plan B, but now I don't think it's a plan B. It's like it's slowly coming into plan A. And the good point is
A.
uh, plan A, you can say now, because see, Akash, you are happy, you are getting all the opportunities, you are reading the same curriculum, the same author, like your friends are studying in India. You're also getting the opportunity to visit, touch these patients, to have a knowledge about the patient. Now what you're talking like a doctor in the third year itself. So I can visualize down the line in 5 years we're going to be very good doctors very soon after completing. Akash, do you think you also have friends from other countries who had gone to other countries, from
Hmm,
in
hmm, hmm,
India,
hmm, hmm.
other countries. So I'm not naming any countries. I'm not sure to demean any countries or upgrade anything. But be
Hmm.
very honest. Are they getting the opportunity of the community medicine?
No, ma'am, they are not getting the opportunity. They have to study separately, and they are not able to visualize it. They are not getting. They are only studying through books. We are studying through the books, the textuals, and also getting in the field. It is a different thing. So
You're
they
getting
are,
patients
and
in their
due to the,
bodies.
yes, ma'am, able to see the patients in the, ma'am, recently in the ward class, our sir taught us about the general examination. We have done the general examination, then seeing many kinds of patients. So it's a really of exciting, ma'am. If
So
I
you
went to other
now
countries,
you feel
maybe I'm not able
complete.
to see.
You feel complete and you feel great. Oh, so here we have a photos of all our dear students who had gone to the community medicine tour. All I can see is dear students Deepa, Anshita, Akash, all my very dear students, Salman, Anas, all are there. So I feel very proud to see, and sorry if I'm missing some names. I'm really sorry about it. But it's great to see all of you growing so nicely with all looking like doctors. And when Akash, I'm talking to you, I'm really feeling so blessed. Oh wow, this is the photo where I really that day I got stuck on.
It is a in Bandar one, ma'am, in the
Yes, our
hospital.
student, dear student Radhesham was also there. Wow.
It is in the it is in Chittagong Medical College.
It is in Chittagong Medical College. Lovely. Akash, wow.
I was taking the all the questions in the Dohasari
Akash, you prepared the question or the prepared these questions were prepared by the college?
by the college.
By the
They
college.
handed over
So
the questions to each and every students. We have to note all the things which were prepared.
so everybody have the same questions. The thing matters
Yes,
how you
ma'am.
answer and how you put your details, right?
No, ma'am. We have to put the details according what the that patient, what the whom we are talking to, they are saying. In this way, we will prepare our statistical report.
Great. So you have a variety of students and any questions not yet. Akash, I think you will get some, calls or, questions from
Okay,
many,
ma'am.
junior students or their parents about. But one thing is we can assure everybody who is, planning to go to Bangladesh that you won't feel you are in a different, altogether a different country. You will feel you are in India itself. As per the language is
I feel
concerned,
in India.
as per the language concerned, students are there, all students are speaking in the same language. Thirdly, food is same. And basic important thing is that you are having your class with the local Bangladeshi students, which is not happening in many other countries. Okay,
Yes, ma'am.
so I think these are USP when you choose Bangladesh, MBBS in Bangladesh. And Akash, in anatomy and biochemistry, you had now what are that is the first year, third year, what are the
Yes.
subjects you are now studying?
Forensic
Community
medicine
medicine.
and community medicine. Forensic
What
medicine
is
and
the
community medicine.
book? What is the book taught there and which author?
Ma'am, in forensic medicine, it is Park. In India, it also followed. In the
Yes.
community medicine, it is the Reddy. In the forensic medicine, it's Reddy. So, ma'am, it is the same book which is taught in India and in Bangladesh. Same book.
That this point I want everybody to note that the same book, same author is also being followed in Bangladesh. Only there are few notebooks and reference books of Bangladesh which is also
Reference
taught,
books are Bangladesh.
which is fine, and these books are very good also. Anyway, Akash, it was always amazing to be on the show with you, and because you have so much of clarity every time I talk with you, you know I really go back to the past and think what you were, that young chap who came to shape up his career, to take a decision with lots of arguments. And today when I talk with you, I really feel blessed, very happy. And
Okay,
we
ma'am.
really can see a very good doctor coming. We wish you all the best. And to the subscriber and viewers of Aspiring Life, keep looking at our channels for more things. We will again come up with the new subjects. And do like our channel and share it to the person who really need it. So Thank you, Akash. Thank you so much for being in the show. Thank you, Akash. Is Akash there?
Yes, ma'am. I'm there, ma'am.
You, Akash, thank you so much
Thank you,
from
ma'am.
your busy, study routine. Whenever I bother you, Akash, can we have a session? You never say no. Anyways, thank you so much. Wish you all of you a very best. To your friends also. Okay, we'll come up with new
Yes, ma'am.
faces and with new topic very soon. Till then, thank you. Namaskar. Bye.